We're joined tonight by Max Nelsen, a policy director at the Freedom Foundation, and psychotherapist, Dr. Robbie Ludwig. Welcome both.
Thanks for having me.
Thank you.
All right, well, we have an interesting discussion here. Where are people's minds at right now in terms of their sort of psychological health and their, I suppose, moral health or thoughts about all this? Dr. Robbie, why don't we start with you? What do you think the impact is on this sort of prolonged lack of ability to have normal social relations?
Well, it's certainly having a ripple effect in terms of the patients that I see, in terms of families feeling stressed, a feeling of isolation and disconnection. And there is a lot of pandemic fatigue, which means that this has been going on for so long that people want to relax maybe some of the strict rules they imposed on themselves at the beginning of this pandemic.
And is that, is part of that the sense that nobody knows when it's going to end? I mean, we were told, 2 weeks to flatten the curve, and that was 8 months ago. So is that part of it?
Yeah, that is part of it, that it's going on for a very prolonged period of time. Sometimes people feel like this won't impact them, and there's some denial. It can be extreme feelings of anxiety or depression or rage that get people to want to just follow what they want to do. It's very hard to adapt to ongoing changes, especially if you don't see it relating to you or if you don't know anyone who's been harmed by COVID. And there are a certain subset of people that enjoy the risk, that are willing to take the risk. But I think basically it's hard to adapt to these changes. They're not easy to comply with, to have a mask, wash your hands, keep social distancing. There are a lot of challenges, as well as we don't have the normal de-stressors available to us. We can't be with people. We can't socialize in quite the same way. We can't exercise in quite the same way. So it just makes life more challenging. And I think people want to regress and just make life easier for themselves.
And Max, I'd like to ask you, at the beginning, there were probably a certain subset of people that, didn't want to comply, but it seems that subset is growing. What do you think's going on socially there?
Well, we're an organization that's based out on the West Coast here, and we've seen a lot of unrest as most of our state governors have reimposed lockdown measures in recent weeks. And the Freedom Foundation's been taking the position that many of these gubernatorial edicts are overstepping. They're doing more harm than good in many cases. They lack legal authority. And certainly, as you mentioned a moment ago, it's having a tangible effect on people out here. Restaurant owners who are being told after surviving the first lockdown in the spring and, limping along through the summer, now are being told you have to shut down again and just deal with it. People who are gym owners and small business owners across the West Coast are facing a lot of difficulty going back into a second round of lockdowns. And so, as we've staked out a position as a group that's willing to challenge some of this, we've seen an outpouring of interest and support from people who are fed up, who don't believe that these countermeasures are in their best interests or are grounded in science, and who object on various grounds. So we've seen a huge spike in interest in people on the West Coast who want to fight back.
So my next question is for both of you, from your perspectives. There's actually been a lot of backlash against governors and officials who are defying their own rules. We saw it happen with Governor Newsom in California. It happened with the New Jersey governor, and a few other cases too. How do you think that is impacting the general sort of social acceptance or mood around these things? Maybe Max, you can take that first.
Well, it's incredibly damaging, and it undermines the impression that public officials want to leave, that this is something to be taken seriously. And look, the virus is something to be taken seriously, and it is a real problem. And people should take reasonable methods to protect themselves and those they care about. But at the same time, we've seen, again, on the West Coast, these governors and have taken very strong and draconian even measures to lock down our economy. And so people see that. They feel the suffering of the lockdown themselves personally. And at the same time, the government officials who are harming them and ending their business and eliminating the dreams that they've had for retirement or just a steady job to take care of your family. As people are seeing all of that and feeling all of that, they then watch their elected officials go have dinners with healthcare lobbyists at high-priced French restaurants, or take golfing trips to Hawaii. Even New York Governor Cuomo this week told the press he was planning on spending Thanksgiving with his 89-year-old grandmother, while at the same time telling New Yorkers they shouldn't be spending time with their families during the holidays. And that's just something that, hypocrisy is hard to take under any circumstances. When your business and your livelihood are on the line and have been destroyed by some of these edicts, it's incredibly hard for people to see their elected officials doing the exact opposite.
Yeah, and Governor Cuomo had to backpedal on that one and cancel his Thanksgiving plans.
I agree with that. I mean, when we see elected officials basically sending the message, do as I say and not as I do, it really can increase a feeling of rage and anger towards these officials, because we all want to spend time with our family. And do these elected officials have certain advantages that maybe the rest of the public doesn't have, like rapid testing or access to certain information that would help them feel more comfortable being with their relatives that are not available to the general public? It really just highlights how there are a different set of rules based on class and money and position. And when people are feeling stressed, isolated, worried about their businesses, really having an increased sense of loneliness and depression and anxiety, and they're told they can't be with family, or they fear that they will get their family sick, it just creates a lot of emotional, psychic issues for them. And it's really not a fair message to send. So we need to do definitely better in that regard.
And Max, from a legal or constitutional perspective, where is the line? I mean, emergency powers were one thing 8 months ago. Now, is it still the same? Do they have the right to make these sort of rules without legislative input?
Well, the governors are certainly acting like they do, and we're challenging that where we can and where we think it's appropriate. Each state has delegated emergency powers in different ways and under different circumstances to their governors, and so there's all sorts of new legal challenges, many of which we're involved with again here on the West Coast, that are testing the boundaries here. These governors are trying to sideline as much as they can accountability from the state legislatures. Governor Inslee here in Washington State has effectively taken over the running of the state government, where in a normal year he would issue maybe a half a dozen or 7 gubernatorial proclamations. He's now said, triggered his emergency powers and has issued over 400. And he's regulating very personal and very detailed aspects of daily life. And at the same time, he's refused to bring the legislature back into session so that we could have a more informed and well-rounded debate and discussion over the best policy responses to these issues that are facing us. So certainly we think governors have overstepped their emergency powers. There are definitely constitutional implications. The unfortunate thing is so much of this is new territory, and it hasn't been litigated to as much as many other significant issues have, that some of these questions are fairly novel, and it's just going to take a while for them to work through the courts. But we are involved in challenging school closures, business closures, and even some mask mandates in court on some of these grounds.
Right, and Washington State, I think just yesterday, said no indoor gatherings at all. Is that right?
I believe it was not quite that strict, but almost. It may as well be. I believe it's limited at 6 individuals and no more than two families or 2 households gathering together. But yes, very, very strict limits up and down the West Coast, and of course things are changing very rapidly.
Do you think this will ultimately go to the Supreme Court?
Well, some of these cases from around the country have already, on preliminary matters, reached the Supreme Court. I think certain of these cases definitely will reach the Supreme Court eventually. It's hard to predict the outcome of any particular case, but there's so much litigation going on and so many new emergency powers being tested and stretched by governors and state authorities. I have to imagine that some of these cases probably will reach the Supreme Court eventually.
So, Dr. Robbie, most of this discussion is more about the civil liberties side of things in terms of what you would say to the world about the psychological impact that you've seen on people. Is the cure, better, worse than the disease from your point of view?
It's such a good question. I think we all need to adapt and take control over what we can take control over. There is a pandemic out there. We need to understand the science, which is changing. We need to look at science that we can trust, like the CDC, hopefully is science that we can trust, and also connect purpose to why we're doing what we're doing. We're doing this for the greater good. We're doing this to protect ourselves and those that we love. And we need to make it easy for ourselves. Have masks available. Make sure you get in the habit of washing your hands and socially distancing, and realize that social distancing is not emotional distancing. Find other ways to feel connected, to understand your feelings and understand that it's okay to have a range of emotions. Have a support group available of people you can reach out to when you're feeling frustrated. And of course, under any psychologically difficult times in your life, it's good to make sure you're taking good self-care. So you want to make sure that you're eating right, you're exercising right, you're getting good sleep, that you find the silver lining in all of this, because there is a silver lining, and to have a sense of humor so that you can psychologically get those endorphins going and help yourself to feel better rather than worse.
All right, we have about 20 seconds left. What are each of you doing for Thanksgiving? Max?
I'm going to be enjoying it with my close family.
And Dr. Rabi?
I'm not traveling. I'm just spending it with my family. I hope they won't get bored of me, but we'll try to be thankful for something.
All right. Thank you both so much for joining us tonight.
Thank you.
Thank you.